Let's continue our IVT tutorial. Today we will start to explain the indications for the intermittent vacuum therapy. We start with the indications in the field of rehabilitation. Which are the indications in rehabilitation? First of all, let's talk about recovery. Then we will see the indications in post-operative, post-surgical rehabilitation, then the post-traumatic rehabilitation, neurological rehabilitation, and last but not least, the early rehabilitation. Let's start with recovery. A faster recovery after training and competition is important. It leads to a better performance of the player because the player can do his next training earlier than the competition. A faster recovery after training or competition is also important as an injury prophylaxis. Less injured player, less injured members in the squad. There are several studies precisely done with the IVT. One of them is a university study from South Africa, Rensburg, and others. Beneath the faster recovery after training and competition, the faster recuperation is also important. Recuperation, the time when the player after rehabilitation prepares again for being able to come into the game, into the competition. So important for all the Olympic athletes for rehabilitation center of which some are even specialized on the process of recuperation. Coming back to training and play faster. Beneath that, IVT has also an impact on the relief of joints and lumbar spine through traction. Nice cases are described by Luis Baños, one of the most the most well-known physiotherapists worldwide even. Here you see how it can be done, how you can profit from the traction. That's not a typical indication, but it works. It was recovery. Let's now talk about post-surgical rehabilitation. There are several conditions post-surgery, for example, after radical urological operations. I got a nice presentation on the IVT symposium. That presentation was given by Dr. Zellner, Johannes Bad Fachklinik Bad Füssen, a German clinic with many international patients, and he showed that the prostata cancer has the highest incidence beneath the cancer of lungs and intestines or bladder. Usually, the radical surgery leads to the outcome of lymphoceles, lymphedema, in the historical collective, even in more than 30% of all cases. Now they started to use the IVT pre and post-surgical, and they showed that the IVT collective shows significant less those lymphoceles. Beneath urological surgery, another cancer is important, for example, the mastectomy. Therefore, we have the Vacuumet ANS device especially for the upper limbs. Post-surgical rehabilitation is also important in the case of endoprothesis. That's the major surgery in nearly all clinics, all hospitals every day, either hip or knee endoprothesis. Also in post-amputations, IVT is given very successfully here. Presentation of Heart and Diabetes Center, also in Germany, one of the most important ones anyway. The outcome of post-surgical rehabilitation is, in any case, a faster decongestion, de-swelling of the lymphedema, which is part of every surgery. The outcome is, in any case, a faster wound healing, which means a shorter rehabilitation process and a better quality of life for the patients. The outcome is, in any case, also the pain reduction for the patient and, for sure, earlier mobilization. These were the post-operative rehabilitation indications. Now let's have a look to the post-traumatic rehabilitation. Also, there are plenty of studies for post-traumatic conditions. I will show you one given by the medical director of a German football club, Bayer Leverkusen 04. They are doing not so bad in the German league. And Yildirim shows that approximately 30% of all injuries and about 27% of the playing time lost are caused by muscle injuries. Those muscle injuries are very well described. There is an international standard how to treat, how to differentiate, and they are using at their own rehabilitation center the VacuSport device or VacuMed device. You see, it's the similar, a little bit with some different programs. For sure, they also have kind of electrocorporeal shockwave therapy or needling or injections. Some cases. Muscular iliacus, injury time, and after 12 days, corona. Let's go back. That was before, and this is after. VacuSport was given daily, immediately after injury, as soon as early as possible. For the player, it was so after 7 days, he starts again running. He came back to training after 16 days, and he was back in competition after 20 days. Another case, musculus adductor magnus, injury time before, and this is after 13 days. Also here, VacuSport or VacuMed, IVT in any case, was given immediately after injury. That player came back to running after 5 days and back to training after 14 days and back to competition after 18 days. One more case, musculus adductor longus. In that case, the player was estimated to be off from the games up to 4 or 6 weeks. But also here, VacuSport was given immediately after injuries, together with injection. After 8 days, he starts to run. After 16 days, back to the training and back to competition after 3 weeks only. 3 weeks instead of 4 to 6 weeks, with the help of the IVT. Last case, musculus rectus femoris. That was injury time after 3 weeks, after 6 weeks. The estimated time off should have been 3 to 4 months. That's the standard. but with the help of IVD, the player was back in the game after 6 weeks already. These were the post-traumatic rehabilitations indications. There were also neurological indications. Which are the neurological indications? For example, fibromyalgia, that pain syndrome. Very nice example from coming from Spain. Luca Baños, once again, thank you. Another indications are the post-stroke patients. They need to become mobilized. Vascular training is important. Also for diabetic patients who often suffer from a polyneuropathy. That could also be from alcohol misuse. We all know this situation. They need to get their mobilization and their vascular training, their flow increase with the help of IVT, intermittent vacuum therapy. Beneath all them, there are needs in early rehabilitation. In geriatric rehabilitation, we should start as early as we can with complex therapies and treatments. Also in neurological or neurosurgical early rehabilitation, it tends more and more to start the rehabilitation as early as possible. And these are new perspectives which only the IVD, Vacuomet or Vacusport are giving, because they do not hurt the patient. The patients are not touched, they are not stressed with other physiotherapy. There's also a field of interdisciplinary early rehabilitation where the IVD offers chances which were not offered before. These were the indications in the field of rehabilitation. You should now be able to answer the questions. What are the indications in rehabilitations? What are the indications in post-surgical rehabilitation? What are the indications in post-traumatic rehabilitation? And which are the neurological indications? And last but not least, what is the outcome of faster recovery? This was the 2 days lecture on indications, especially on the indications in the field of rehabilitation. Thank you very much for today.